All right, good afternoon and welcome everyone. My name is Rashi Romanoff and I'm the Vice President of Programs and Partnerships for the Elizabeth Dole Foundation. We're so excited that many of you are able to join us for today's Spotlight Series webinar on accessing VA rural health resources during the COVID-19 crisis. I wanted to just share a few words about the Elizabeth Dole Foundation for us to get started. We were founded by the amazing Senator Elizabeth Dole in 2012 and are fully dedicated to supporting and empowering our nation's 5.5 million military and veteran caregivers, as well as their families. In this uncertain time, EDF has teamed up with our partners at the U.S. Department of Veterans Affairs and at Philips to provide veterans and their families with information around high priority topics during the COVID-19 pandemic. Our first two sessions focused on telehealth services as well as whole health resources. The links are available on the slide below and will be chatted out in just a moment. We're proud to say that we've had close to 22,000 views of each of these episodes over the last few weeks, and we encourage you to go ahead and take a look at these if you haven't already to catch up on some other content that we've already covered. This month, we're really excited to be working with the VA to bring you content related to how veterans and their families can access rural health resources during this time. A couple of housekeeping notes before we fully dive in. We have a lot of information to cover, but we will take questions towards the end of the webinar. Feel free to submit any questions using the Q&A box located in the Zoom control panel. During this session, 3 people who submit questions will be randomly selected to receive a $25 Amazon gift card as a part of today's broadcast. So submit your questions and be sure to listen for your name at the end as we draw those towards the end of the session. I also want to mention to all attendees and presenters that this is a recorded broadcast. Today's webinar will be available and shared following this session, as well as all relevant links and presentation materials. And with that, I'm really happy to start today's presentation and introduce Dr. Stephen Lieberman. From the beginning, we're really so happy to be joined by our great partners at the U.S. Department of Veterans Affairs for this Spotlight Series sessions. Their support has really enabled us to launch this significant Spotlight Series together with Philips, and for that, we are very, very grateful. Dr. Stephen Lieberman currently serves as a Principal Deputy Undersecretary for Health at the U.S. Department of Veterans Affairs. In this role, he leads clinical policies and programs for the Veterans Health Administration. Dr. Lieberman has more than 25 years of experience with VHA, working at both central office and at VA hospitals in Massachusetts and New Jersey. Dr. Lieberman, I'll now turn it over to you for a brief welcome.
Hello, everyone, and thank you for joining us today. I also want to thank our exceptional partners at the Elizabeth Dole Foundation. In VA, we are truly grateful to have a partner so dedicated to caring for our nation's veterans and their caregivers. It has been about 6 months since we first became aware of COVID-19. This remains the biggest healthcare challenge of our lifetime. As always, during this time, VA's highest priority is to ensure the health and well-being of veterans and their caregivers. Today, I will provide you with an update on some of the ways we are responding to COVID-19 that includes a special focus on our efforts to care for rural veterans. VA remains busy with its response to the pandemic. We continue to focus on basic infection control measures that make a difference with disease prevention, including requiring everyone at our facilities to wear a face covering, screening all visitors and employees for COVID-19 at the entrances of our campuses, reducing in-person patient appointments in locations where COVID-19 cases are accelerating, and restricting access to visitors in locations such as our community living centers and spinal cord injury units. While such restrictions may be inconvenient, they do appear to have saved many lives. I strongly encourage all of you to wear masks or a cloth face covering when you leave your home, particularly if you may be in the vicinity of 1 or more people, and to physically distance yourself from them by at least 6 feet. It is also invaluable to use either hand sanitizer and you rub your hands until your hands are fully dry, or wash your hands with soap and water for 20 seconds. You should do that every time you touch a surface. You also should never touch your eyes, nose, or mouth after touching a surface or touching another person. Scientific study after study has demonstrated that your risk of COVID-19 infection is reduced with simple efforts, such as what I just described with wearing a face covering, physical distancing yourself from others, and keeping your hands clean and away from your eyes, nose, and mouth. VA continues to offer testing to patients and staff across the country. We have hired over 26,000 new staff since the beginning of March, including over 5,000 nurses and 800 physicians. This has helped us to increase our inpatient beds across the country by over 3,000. VA has grown face-to-face visits in one or more clinical services at 124 of our facilities as a part of our re-expansion. Unfortunately, because of recent increases in COVID-19, 45 of those sites have had to pause further expansion. VA established a nationwide monitoring tool that provides us with ongoing information about our communities across the country, including infections in veterans and staff, as well as in the larger American population, staffing levels, and personal protective equipment quantities. Based upon the impact of COVID-19 in different parts of the country, we can quickly move staff, machines such as ventilators, and personal protective equipment to any VA in the country to ensure we safely and effectively meet our patient care needs. VA also continues to support humanitarian care for non-veterans in both urban and rural areas of the country, now having served in missions in 46 states, including in Indian country and the District of Columbia. I am proud to share with you how VA has been improving care for the nearly 3 million veterans living in rural areas who rely on us to meet their healthcare needs. Of note, while 37% of veterans living in urban areas are enrolled in VA for care, 57% of veterans living in rural areas are enrolled in VA care. VA continues to innovate approaches to best care for those that live in rural areas. This has been happening long before COVID and continues to this day. There are many challenges to delivering healthcare in rural areas. Just like in the private sector, we face challenges with recruiting staff to rural parts of the country where there is a particular shortage of specialty doctors. There are also the obvious geographic and distance barriers, along with limited broadband coverage that is needed for telehealth appointments. All these challenges have increased VA's commitment to ensure that we provide rural veterans access to the high quality of care they deserve. One way we're improving care for our rural veterans is by delivering specialized training for our existing staff in rural areas. VA has trained over 12,000 staff providing care in rural areas on topics such as elder care, psychiatry, suicide prevention, and women's health. Another way we're improving rural access to care is through our telehealth program, which has grown considerably during COVID-19. Since March 1st, we have seen over 1,000% increase in telehealth, including telespecialty care, since March 1st to home or to the location of the veteran's choosing. For example, over an 18-month period, VA nurses provided specialized care for veterans with diabetes in rural areas using telehealth. This resulted in meaningful improvements in their diabetic test results. Of note, this program, like other telehealth programs, has continued without any interruption during COVID-19. Many rural veterans do not have adequate internet capabilities to receive VA telehealth care, but we are continuing to expand access via creative approaches, including community partnerships. VA has teamed with Walmart, the Veterans of Foreign Wars, the American Legion, and Philips to create the Accessing Telehealth Through Local Area Stations, also known as the Outlets program. You will be learning more about this wonderful new and growing program later in this webinar. We've also improved our ability to provide eligible rural veterans with the choice of receiving care closer to their homes through the VA Mission Act. The Mission Act also enabled increased incentives for recruiting physicians into rural areas, created a pilot program to expand medical training in underserved areas, and had VA focus on improving access into the most underserved areas of our country via mechanisms including mobile clinics and telehealth. That completes my overview of COVID-19 and healthcare in rural communities. Please remember that, as always, we are here for you if we can assist in any way. Back to you, Rashi.
Thanks so much, and we appreciate those kind words, Dr. Lieberman. I really want to thank you on behalf of the Elizabeth Dole Foundation and everyone listening in, and really all of the frontline healthcare workers at the VA who are working overtime to support our veterans and caregivers each and every day. So a big thanks to you for joining us. I wanted to spend just a few moments talking about challenges that we at the Elizabeth Dole Foundation have heard from some of our rural caregivers over the last few months. Since this crisis began, we've taken a number of actions in response to COVID-19. We've actively surveyed veterans and caregivers and really used that information to create a dedicated COVID-19 resource hub on our website at hiddenheroes.org. And there you can find fact sheets, breaking news, resources, and also the episodes that we mentioned earlier as a part of this Spotlight series. And they're ready to access right now, and we'll be sure to chat those out to you in a bit. We know that the last few months have been a really challenging time, and that these challenges have really been exacerbated for those veterans and caregivers living in rural areas. In the early days of COVID-19, our surveys revealed that service members and veterans were facing an increased stress and mental health challenges as telehealth services were getting off the ground at the VA and elsewhere. Additionally, we received many concerns and many respondents talking about how the needs for groceries and supplies deliveries were quite limited given the rural access areas. These kinds of offerings can be even more difficult as time goes on, as supplies are limited and as people are having issues connecting to broadband internet, as well as accessing more convenient online resources. We're really excited today to be joined by Dr. Thomas Klobucar, the Executive Director of the VHA Office for Rural Health, who's going to help talk a little bit about these issues and what VA has been doing. Dr. Klobucar leads the Office of Rural Health and its 5 rural veterans health resource centers, all focused on conducting research into issues affecting rural veterans and creating innovative new programs to address challenges in delivering care and services to our rural veterans. A retired Air Force Senior Master Sergeant, Dr. Klobucar came to VHA in 2010 as a telehealth research associate in the Veterans Rural Healthcare Resource Center in Iowa City, Iowa. Dr. Klobucar, thank you so much for joining us, and I'll let you take it from here. I think you might be on mute. Yeah.
How about now? Can you hear me now?
Perfect.
All right, great. Yeah, I was double muted there. So thank you, Rashi, for that kind introduction, and thank you, Dr. Lieberman, for teeing this important topic up. I'd like to give special thanks to the Elizabeth Dole Foundation for putting together this opportunity to advocate for rural veterans and their families and caregivers. So today I want to spend a few minutes talking about the challenges that our rural veterans face, challenges that in many ways are the same as for all rural Americans. Then I'll talk a little bit about some of the things we're doing in VA to address the challenges, focusing in on innovations in caregiver support programs, many of which have materials and tools that are available for use by everyone. Next slide, please. So I was fortunate enough to live in a small town in a great state of Iowa for nearly 18 years after I finished my time in the Air Force. And while I really valued the time I spent there with my family, being an Iowan also acquainted me with some of the challenges inherent in living rural. I'm quite certain that for those of you who live in rural America now, none of these things on this slide here are a big surprise. Rural America is in fact defined by some of these things. The geographic and distance barriers that stand between veterans and caregivers and their services are the same for all of us who live in rural. We all experience provider shortages, and I'll talk a little bit more about that in a minute, and grapple with barriers and challenges in the social determinants of health, such as housing, education, employment, and in particular, transportation services. Transportation barriers can keep rural dwelling Americans, particularly older Americans, from accessing healthcare, employment, information, and even social connections. You know, broadband in rural areas is a blessing. It can help us overcome some of those barriers, but only if you can get broadband. Limited broadband coverage is a thoroughly modern and a thoroughly significant challenge for rural veterans, their caregivers, and their friends and families. So there is a significant number of rural Americans and veterans that simply don't access internet in their homes, either because they can't afford it, and we'll talk about that in a second, or that it simply isn't available. In VA, we try to address the broadband access problem in a number of ways, including issuing tablets to veterans so they can access healthcare services and making broadband and even telehealth available at our VA facilities. But like transportation, broadband internet access means healthcare, employment, information, and even social connections. And for those veterans and their caregivers that can't get internet at home, we are working with our partners and non-governmental organizations that Dr. Lieberman mentions, like the veteran service organizations like the Veterans of Foreign Wars, the American Legion, the Iraq and Afghanistan Veterans of America, and others, and along with partners in business and industry like Philips and Walmart, and a host of other partners to help veterans get the care and services they need virtually, when that makes sense. My colleague Nathan Naylor from Philips is going to talk in a few minutes about some of the solutions that are already impacting access to care and services for veterans and their caregivers in a very significant way. So let's take a brief look at rural veterans in a comparative context. So next slide, please. So I really love this slide because it shows in a nutshell some of the more salient demographic characteristics of our rural veterans. And if you look at this figure on the left below the green check mark, the one Dr. Lieberman pointed out, nearly 60% of all rural veterans depend upon the VA for health care. In a minute, we'll look at some data that may tell us why they're more likely to depend on VA. And if you look down below there, on average, rural veterans earn less money and are significantly older than urban veterans. And rural is particularly challenging for our women veterans, who in the best locations have to work hard to find adequate health care, but in rural find that task even more difficult. So we've talked a little bit about the veterans, we talked a little about the challenges, so let's take a look at some geography. So next slide, please. This map shows what rural looks like in the United States. Now, there's a lot of ways to think about rural and urban. I think the Washington Post reported there were 13 agencies with 13 different ways of doing it. But no matter which system you use, you can see that the overwhelming majority, 83% in this measure, of the land mass in the United States is most definitely rural. And that's what's represented here, and I'm drawing on my military background here. The khaki-colored portions of the country are rural. And a significant part of that khaki-colored part is dark brown, and that means highly rural. And the easiest way to think of highly rural is 7 or fewer people per square mile. So a couple of more facts about rural America. Of the 3,000 counties approximately in the United States, 2,300 of those are rural. Rural America comprises 19% of the population of the U.S., 18% of the jobs, but just 14% of the earnings. So hold this map in your head for a second while we look at the next few maps. Next slide, please. Next slide, please. Okay, this map is what shows, no, previous slide with the blue on it, please. This is what rural enrollment in VA healthcare looks like. Each blue dot represents a rural veteran. So there are 3 million blue dots here. You'll note that counterintuitively, the bulk of our rural veterans live in the eastern half of the country. But that is changing as veterans, like the rest of the U.S. population, are slowly migrating to the south and to the west. So keep that one in your head. Now let's go look at the next slide and look at what healthcare access looks like. So this slide shows us what medically underserved America looks like. And this map shows primary care shortages across the country. Does it look familiar? Does it look a lot like that first map that I showed you with the khaki-colored rural America? The fact is that the federal government now designates nearly 80% of rural America as medically underserved. And while rural is home to 20% of the U.S. population, fewer than 10% of America's doctors live in rural. So, and that's worsening each year because what we call the gray wave. Rural doctors are on average 3 years older than urban doctors. Half of them are over 50 and a quarter of them are beyond 60 years of age. Projections are that rural doctors, physicians will decline by 23% over the next decade. And that's just primary care. Show the next slide, please. See the similarity among these slides and the khaki one that we used to define rural? These are all maps of rural America. Let's talk a little bit about mental health care and geriatrics. If you look at the 734 entirely rural counties in the United States, about 3% of them have 1 to 4 psychologists. 4% have 5 or more licensed psychologists, and 93% have no licensed psychologists whatsoever available resident in those counties. And when you think about geriatrics, remember we said the rural population was significantly older than the urban population. About 60% of them are over the age of 65, and those over the age of 65 use a disproportionate percentage of all healthcare services, and more than 80% require care for chronic conditions like hypertension, arthritis, and disease. So this shortage of healthcare providers affects VA's ability to hire just as it does our partners in the community. All of the healthcare challenges that Americans face affect the ability of VA to deliver care to our patients, to our veterans, and to support their caregivers, just as they affect our community partners who are so important in the delivery of care to all Americans, including our veterans. So let's go to the next slide, please. To try to address some of these challenges, in 2006, VA and Congress got together and created the VA Office of Rural Health. And this slide shows our charter, which after you dig through all the legalese up there, boils down to simply this. This office and its 5 Veterans Rural Health Resource Centers in Portland, Oregon, Salt Lake City, Utah, Iowa City, Iowa, Gainesville, Florida, and White River Junction, Vermont, were created to work across the VA to conduct research into areas affecting rural veterans, to address gaps in access to care and services through innovations in rural health care delivery, and to spread those innovations across the enterprise. Next slide, please. And we do that through our innovations in rural promising practices programs and by working with clinical offices in VA to stand up enterprise-wide initiatives to rapidly address access challenges and expand national program office efforts to serve rural veterans. And we'll talk a little bit later about the innovations in caregiver support that have grown out of these programs. So the next slide, here's a slide that just shows a few of those enterprise-wide programs. There's a lot here, and you can look at this whenever you want. But I just want to point out that those highlighted in green are all telehealth programs. That reflects the importance of telehealth links in serving our rural veterans. Next slide, please. So we pulled these next initiatives out to give you a sense of the breadth of these programs that deliver inpatient and outpatient services, including in-home rehabilitation services that expand an integrated network of specialists who are specifically trained in delivering physical and rehabilitative therapy to rural veterans using telehealth technology, vitally important for our rural veterans. Some of the other programs I wanted you to see are on the next slide, please, is VA's Clinical Resource Hubs. This is a relatively new innovation in VA. And really, one of our greatest challenges in getting healthcare to patients is access to healthcare resources in rural places because of the provider shortages that we talked about before. In 2020, VA developed a new initiative that provides clinical resource hubs in all 18 VA networks to deliver virtual healthcare to spoke sites across the country. These spoke sites can be in patients' homes, VA medical facilities, in space shared with our community partners, and in places like this Atlas program that Nathan Naylor is going to talk about in a minute, delivers care. So the next slide is a map that shows their reach, and if you flip real quickly to that, we use light blue lines because if you used anything heavier, it'd be difficult to see what we've got there. So again, look at that at your leisure. But now I want to turn to our caregiver innovations. And let's start with medical foster homes. That's the next slide. And you'll see there's a CBS News story over there that we really wanted to show, but due to technical difficulties, we're not able to broadcast it to you. But they promise that they'll put the link in the chat box for you so you can take a look at it when you get a chance. It's really a great story about VA medical foster homes. And these basically are private homes in which trained caregivers provide service to a few individuals. And they really serve as an alternative to nursing homes for veterans who need nursing home care, but prefer a residential setting. In partnership with the Office of Geriatrics and Extended Care and led by that office, the VA supports increasing access to community-based alternatives to nursing home placement for rural veterans, and that includes our caregiver programs. Next slide, please. We also have a program called Reach VA, Resources for Enhancing All Caregivers' Health, VA. And this is designed to assist caregivers of veterans with challenges such as taking care of yourself, problem solving, mood management, asking for help, and stress management. The goals are to decrease caregiver stress, improve the management of patient behaviors, and we use this approach that assigns 4 sessions on the phone to coach through some of the obstacles and challenges that face our caregivers. Really has shown significant improvements in caregiver quality of life, decrease of burden and depression, improving emotional well-being, and decreasing the number of troubling patient behaviors and safety risks. Very effective program, continues through to today. Next slide, please. One of our important pilots was this one, supporting caregivers via telehealth. Pilot participants quickly learned that video telehealth, or what we call VA Video Connect into the home, is an incredible tool for providers and caregivers. Not only was it easier for caregivers to connect the VA support virtually, but appointments were more easily scheduled around the caregiver's busy schedules. Veterans and caregivers found it convenient to connect online rather than having to travel to VA for an appointment. The Video Connect reduces travel time, eliminates travel in many cases, and the virtual encounter really enabled a visual connection for the caregiver. Made a significant impact on their lives. Next slide, please. The next slide shows one of our ongoing support programs that provides tools to caregivers across VA and across America that are accessible to anyone who's looking for caregiver resources on our website. See the bottom of this page on there. There's another link. It gives access to videos to educate and help caregivers to get through difficult moments. There are 36 of these online videos available with topics that range from taking care of your veteran to taking care of yourself and anything in between. Please visit this website and take advantage of these excellent tools. Next slide, please. So the next 3 slides, and we'll have ended up talking about 7 programs here. The next 3 slides outline programs that underscore how important virtual face-to-face visits have become for supporting caregivers, including this one, wherein a licensed clinical social worker provided telephone support, and the internet and home telehealth technology allowed them to monitor patients' interventions and assessment responses and triage responses according to the greatest need, and to answer caregivers' questions at any time during the process. And then there was this innovation. Next slide, please. And the important takeaway from this next one is that middle bullet there under impact. Contrary to what a lot of folks assume, access to and discomfort with internet are declining significantly for rural older adults. And this is an important lesson across the board, is that the senior population is not as resistant to telehealth technology that many of us believe. And finally, this innovation. When it was piloted, it was so successful that the Caregiver Support Program and our resource center in Salt Lake City developed a national plan to help all caregiver support coordinators across VA to implement VA Video Connect at their own facilities. This plan rolled out just as COVID-19 was beginning to push much of VA care onto virtual platforms. And so now these coordinators are using VA Video Connect in a wide variety of ways to connect with caregivers, and they're offering individual support and assistance to caregivers, and even facilitating support groups for caregivers, and they can attend in the comfort of their own homes the way we're doing this today. So while the VA's made significant progress in creating caregiver support programs in so many ways, we also, as I mentioned before, rely on our partners to help our veterans get access to the care they have earned through their service. So at that, I'll turn the floor back over to Rashi so you can hear about some of the great work our partners have been up to increase access to care and services. Rashi?
Thank you so much for that presentation, Dr. Klobucar. I know we got a lot of questions coming in as you were speaking, so really excited for our Q&A in just a bit where we can get to the next level of detail. Before we do that, though, we're so excited to be joined by our partners at Philips today. I know in the earlier remarks, you've heard a couple references to Project Atlas and some of the work that they're doing. So we're really happy to have Nathan Naylor join us today to talk a little bit about some of these initiatives and give us an update on where these things currently stand. I wanted to give you just a little bit of background on Nathan. Nathan leads Veterans Healthcare for Philips North America. He served at the VA as the Deputy Assistant Secretary of Public Affairs for 4 years and as a staffer at the Senate and White House in years past. He and his wife come from military families and have both been caregivers for veterans from World War II, Korea, and Vietnam. He's obviously also a huge fan of Senator Dole's, and we've been so happy to work with him over the years on our partnership, everything from the caregiver journey map to our convenings. So we're really excited that you're here today. Nathan, I'll hand it over to you.
Thanks, Rashi, and thanks, Tom. And as I'm sure most of you know, it's incredibly difficult to say no to Elizabeth Dole, just like Tom Hanks has said. So, so it's a pleasure to be here. Next slide, please. So today we're going to talk. I'll talk with you briefly about the Atlas program and the virtual care station that has come about from a collaboration between Philips, the American Legion, Veterans of Foreign Wars, of course VA, but also Veterans and Caregivers, like many of you on the phone and on the call. The thing I want to say before we get started on this deck is that Atlas is about making sure that you or your loved one gets to maintain and build their relationship with their VA doctor. Slide, please. Okay, so we know that, millions of Americans, and certainly many of you, live in rural communities. They're often far from VA facilities. Next slide. Veteran service organizations like Legion and VFW have been part of local communities like my hometown in Springfield for generations. Next slide, please. And pictured here, this is Rick and Mel Weldon, who command the VFW post in Eureka, Montana, the first site of the Atlas virtual care station. So last year, some of us lucky folks at Philips joined with some of our partners at VA, the Legion and VFW, and we traveled to places like Eureka and my hometown of Springfield to meet with rural and underserved veterans and caregivers to better understand how we could help extend telehealth to their communities. Slide, please. So we found what Tom already briefed about, and that's that veterans believe that telehealth can improve their lives, and veterans from all eras and conflicts have a willingness to embrace telehealth. Next slide, please. But as Tom was talking about before, there are some impediments that many of you know all too well to accessing telehealth. The first one is well known, unreliable access to broadband internet, or maybe it's the lack of a tablet or a smartphone. But a third one that we didn't know and that we learned thanks to many of the hidden heroes from Elizabeth Dole Foundation is that sometimes there's limited privacy at home. Perhaps you or your veteran live with a son or a daughter, or maybe there are some topics that veterans don't want to discuss within earshot of a spouse or a roommate. So privacy. Next slide, please. So this is my colleague Sean Hughes, who leads Philips Design for Philips North America. So together with VA, the Legion and VFW, and the Hidden Heroes Caregivers from EDF, we really did roll up sleeves and envisioned what, as Sean would call, a purpose-built telehealth environment, what it should be. Next slide. Hey, who's this handsome guy? So Philips leaders gave my colleagues and I permission to pull resources from across the country, from across our entire team at Philips for Project Atlas. And fun fact, the young lady in the polka dotted shirt is my 16-year-old daughter. And this is Linesville, I'm sorry, this is Los Banos, California. Next slide, please. So VA gave us a bit of a curveball on Atlas. The first thing they said is they wanted Atlas to be as effective as an office visit. But Dr. Galpin, the chief of telehealth of VA, then said, but we want it to be like you're in your living room. So this bedeviled us a little bit, but we really went back and thought about that so that we could create a face-to-face conversation between you and your clinician. And by the way, this is Leslie Ruse, a critical care nurse who heads up the Atlas Program Management Office. Next slide, please. So here's the secret sauce. The Atlas Virtual Care Station is all about enabling remote consultations with your doctor that feel like a face-to-face office visit. Not a doctor that you haven't met before, unless you need specialty care that you haven't in the past, but your doctor. Next slide, please. So making VA healthcare more accessible for veterans and caregivers was our mission. And we co-created the Atlas environment, both with VA clinicians, certainly veteran patients, and caregivers. And I'm going to point out on the next slide a couple things that you caregivers out there really helped us with. Next slide. Oh, next slide, please. Thank you. Okay, so this is the Atlas. In the yellow circle is the Atlas. Oh, could you go back one? I'm sorry. Sorry about that. Okay, so in the yellow circle, this is the Atlas Virtual Care Station pod, and in the green circle, there is the wall. The wall is one of 4 sides, and the pod has all 4 sides. And what we realized, thanks to the Elizabeth Dole Foundation, is that many veterans in the top right-hand corner may go into either a telehealth appointment at home or at an Atlas site by themselves, but a whole lot of them take a caregiver. And as I know from my own family experience, the reason why you take the caregiver is often a veteran may, when asked, how you feeling, their response may be, great. And if the caregiver isn't there with them, the clinician may not really get a full debrief on what's happening with that veteran in their healthcare journey. We also know that many veterans present with a service animal. So the Atlas pod needed to be able to accommodate a spouse, a service animal, maybe both at the same time. And then certainly in the bottom picture, there are many veterans that have mobility issues. And so we needed to make sure that Atlas could have no wrong door for any veteran presenting. Next slide, please. So the Atlas Virtual Care Station, this is what it will look like when you or your veteran and you present at an Atlas Virtual Care Station. Your VA doctor is at your eye level. The camera to talk with your doctor is also as close to eye level as we can get, and it's also ready to handle some advanced features of remote patient monitoring that can be done over a camera or a smart microphone in the future. And it's also clinical grade lighting that both helps the clinician be able to see you best, but also enables some of the Philips technologies of the future to be able to work. Next slide, please. So this is the schematics of Atlas. It's very exciting. I know I'm a little short on time, so I'm going to boogie through these slides, but they'll be in the deck, and I welcome your questions later. Next slide, please. So Philips out of the generosity of our leaders, Philips has committed to donate the 10 initial Atlas virtual care station sites, 5 for the American Legion, 5 for the VFW. The first Atlas site in Eureka, Montana is a VFW post. And I'm proud to say that the first American Legion site is my grandfather's post, post 176 American Legion in Springfield, Virginia, that I'm a member of the Sons of the American Legion, and that's my post. Next slide, please. We're also talking, as Tom mentioned earlier, we're also talking with some of the large retail partners that we have, such as Walmart and others, about what Atlas could look like in a retail environment. Next slide, please. So we're almost done here, but I want to make sure you all know, for those veterans that you do have broadband access in your house and you choose home-based telehealth, we learned lessons along the way that weren't just about the virtual care station. And we took those lessons to heart, and we created a miniaturized version of the Atlas virtual care station that is right now, for lack of a better term, called the Veterans Choose Home Footlocker, that I'll show you on the next slide. So Footlocker, or or whatever we wind up calling it after the pilot, will be able to ship to a veteran's home pre-configured, so that you don't need either spend time configuring it for yourself, or having a grandson or a son come by, or a daughter come by to set it up for you. And it would be custom delivered to have the kind of chronic condition patient monitoring devices that you specifically might need, like a pulse ox monitor or something else. Next slide, please. We envision both the Atlas Virtual Care Station and Footlocker as being supplements to VA's ongoing telehealth portfolio. And so this is just a rendering of seeing how, at first VA had medical centers, VA medical centers, and then you moved at VA on to community-based outpatient centers, mobile vet clinics, vet centers. And so Philips believes that Atlas and Footlocker are natural extensions of the progression of the diaspora of VA healthcare over the past decades. Next slide, please. One last thing. Atlas not only has use cases for VHA, the Veterans Health Administration. I know that Cheryl Mason, the chairman of the Board of Veterans Appeals, is bullish on what Atlas virtual care stations can do for rural adjudication and hearings of Board of Veterans Appeals cases for those veterans that are appealing a decision. We can also look to support the Veterans Benefit Administration for post 9/11 GI Bill benefits, compensation and pensions benefits, SEGLI and FEGLI life insurance, and the rest. So Atlas can not only help VHA extend care, but it can help the entire VA enterprise extend the benefits and services that veterans and their caregivers earned and deserve, and also can even help on the DoD side. There's no reason why Atlases couldn't be located at Class 6s, commissaries, and PXs, because I know many military families, many veteran families, are still going on post when they're getting their groceries and other things. So next slide, please. I'm really going to skip over this slide, but this is more to the Principal Deputy Undersecretary of Health and Mr. Klobucar, Dr. Klobucar. And I just want to say finally, thank you so much for your service, and it's really our honor to serve you. And thank you to the caregivers for helping us envision the virtual care station. Rashi.
Great. Thank you so much for that excellent presentation. And again, we got a lot of questions. I will say, Nathan, you can go ahead and look through the chat. There were a lot of really exciting comments and even a couple suggestions for the Footlocker name once the pilot's over. So I think you'll enjoy reading through some of those. Before we jump into our Q&A We did just want to direct everyone to our hiddenheroes.org site. If you're a caregiver in need of support, we invite you to join our online community. It's free. In addition to accessing resources and finding a community of support, there's also a special section on our website where caregivers, service members, and veterans can ask us any question on any subject related to their needs, as well as any questions related to COVID-19. So encourage you all to join us. There's lots of really exciting benefits of being a part of our community, and it's really the easiest way that we're able to communicate with our caregivers on a number of different fronts. And with that, I'm going to hand it over to Aubrey, who I know we've been sort of going back and forth and formulating some Q&A based on what we've received. So Aubrey's going to help us sort of walk through some of the questions we've gotten.
Awesome. Thank you so much, Rashi. And thank you to all of our speakers, Dr. Lieberman, Dr. Klobucar, and Nathan for joining us today. Before we get into questions, we do still have those wonderful Amazon gift cards that we are awarding to some of our attendees today. So I want to just shout out 3 of our winners. We have Susan Birch, Alfie Alvarado, and Carolyn Bridgewater. All 3 of you are going to be receiving an Amazon gift card, a virtual gift card, if you will. And so we'll be reaching out to you in the chat box to find out exactly where we should send those, but congratulations to our winners today. And let's dive into some questions. We have about 10 minutes here. We have a lot of questions coming in through the chat. Again, if you do have a question, please be sure to submit that in our Q&A box, which is located in the Zoom control panel. If you're joining us on Facebook Live, feel free to type in your questions using the comment box that's on our Facebook page. So the first question that we have is for Dr. Lieberman. How is the VA connecting directly with the rural veterans for COVID testing?
So thank you for that question. It is certainly a challenge for veterans and non-veterans to undergo COVID testing in rural America at this time. We are, as we reopen some of our clinics in more rural parts of the country, certainly that would be an option. But I can tell you that as a part of the Mission Act, we're actually working right now actively with our third-party administrators, which are some of the companies we work with, to see those that really have locations in rural parts of the country can provide such testing. And I am cautiously optimistic that we will have that available across the country in more rural parts within the next few weeks. So, but in the meantime, I would encourage you to call your VA medical center and find out what they have available so you can get that testing if you need it before we can make it available closer to your home.
Great, thank you so much. Next question I have here is for Dr. Klobucar. How is VA utilizing the reach of its partners and the state Veterans Affairs departments to increase its penetration in the rural communities? Oh, I think you're double muted again there.
I am double muted again. I'm assuming you can hear me now. I'll learn by the end of this call. So I think it's important to note that the organizations like the National Organization of State Offices of Rural Health are vital communications conduits for us during this COVID-19 pandemic. We're actually working with our partners in those organizations, state offices of rural health, state departments of Veterans Affairs, and so on, to communicate about VA services and training in the specialized areas that is available to the community during this crisis. We assume that those links will continue beyond the pandemic, and we'll continue to try to utilize them in partnership meetings with them across the board. But it's ongoing right now, and we hope that it continues well into the future.
Great, thank you so much. And while I have you still on here, another question here for you. Are the programs that you mentioned in the presentation today, are they available for all caregivers or just those in the caregiver program?
So let me say that it varies by program. Some of the programs are specific to those who are in the caregiver program, while others of them, and there's a lot of tools available that are available online. And I want to plug this website. You can go to the Rural Health website and find links to what we've worked with our partners to produce. But if you go to caregiver.va.gov, There is a myriad of support tools available to virtually anybody in the country, and veteran, non-veteran, caregiver, whomever, and they have points of contact at local VA medical centers. They have outlines for their programs. They have instructional videos in addition to the 36 that I talked about. It's a really terrific resource for caregivers. I encourage you, again, that's caregiver.va.gov.
Wonderful. Thank you so much. I'm going to bring Nathan back on here from Phillips. So we have a couple of questions coming in about Project Atlas and Foot Locker. One person in particular really wishes there was a Project Atlas close to their home. Their home is in rural Louisiana. So Nathan, number one, is there an Atlas program available in Louisiana? And if not, how can they request that one be added, or how are those locations decided?
So on this, I would defer to Dr. Klobucar, because Atlas is a VA program. The virtual care station is what Phillips, that was the homework that we did for Atlas. But Atlas is a larger program than just the Phillips donation for the pilot. And certainly we hope to be able to, once the VHA evaluation of our pilot program is complete, we certainly hope to be able to scale programs like Atlas and Foot Locker beyond the pilot. But as far as Atlas is currently in, I believe, 5 Walmart locations that Phillips is working with, but these are mostly Walmart. I mean, they're entirely Walmart pilots right now, and so I mean, I think probably the best way is to reach out to your local CBOC or VAMC and let them know that you might be interested. But Dr. Klobucar?
Am I muted? Okay, that's great advice, Nathan. Thank you. Yes, I encourage you to reach out to your local VA medical center to discuss receiving care in your home or in your community. You know, as Nathan mentioned, Atlas is a nascent program. It's just getting a start. So as part of this pilot process, we're doing evaluations, and we'll make determinations about what the viability of it is long-term for nationwide deployment. But it's certainly, the outlook is great. And as our telehealth clinical resource hubs strengthen and develop, we expect to see more and more care in the community that's made possible by this VA Video Connect system that the VA has developed.
Great. Thank you both so much. Another question we have for Dr. Klobucar, are the caregiver homes run by home care agencies? And if so, how many live in the home, and what is the ratio of caregivers to residents?
I would be happy to get detailed information at that level for you, if there's a way that we can communicate this through the Dole Foundation. I know it varies across the board, and there are rules about population and so on and so forth, but I can't give you a definitive rule about what that looks like. Happy to find out for you, though.
Thank you. This next question I have here is for Rashi. So this person is a caregiver who does not have access to broadband internet. Are there any offerings that exist to help them in that?
Yeah, absolutely. You know, our partners at AT&T and at Comcast, you know, work really hard to provide low-cost internet options across the United States, across U.S. territories. So if broadband internet is not available in your area, I recommend reaching out to representatives from either of those companies. They both have, you know, limited time offerings related to COVID-19 and might be able to help you secure some Wi-Fi support. So that would be my recommendation. And Dr. Klobucar, I don't know if there's anything else you would mention on that front.
No, I don't think so. I think that's a pretty complete answer, Rashi. Thank you.
Great, thank you. This next question I have here, I want to be mindful of time. We have just a few minutes left to go in this session. Nathan, this next question is for you. We are receiving a lot of great comments about the Foot Locker. For some folks, recognizing that transportation might be an issue in some rural areas, and the Foot Locker would be something that would really help them out with challenges like that. with the footlocker, would an individual have to have access to Wi-Fi in their homes in order to access that?
Yeah, that's a good question. There are a couple different build versions of footlocker. One design element would ship with a cellular hub that all the peripheral patient monitoring devices would go through, and then it would use the air card on the hub that is pre-programmed for Lance Corporal Naylor even before it ships. Or another variant of that would use terrestrial Wi-Fi that's already in the home. So that would probably be something that that the clinical care manager at VA would help coordinate.
Excellent, thank you so much. I now have a question here for Dr. Lieberman. Does the VA plan to continue offering virtual mental health care after the pandemic is under control? And what are the VA's plans to extend virtual mental health?
So telehealth was viewed, and virtual health in general is viewed as being the future of healthcare in this country. So we believe we were going to be growing even before COVID came along, and COVID, I think, helped get us faster to that point. We hear from most of our veterans that they really like telehealth mental health as well as other forms of telehealth. And so, yes, we intend to offer it as much. If the veteran wants it, we want to make it available. We will continue to look at opportunities to expand in the virtual health world, particularly in specialty care. We're doing, as was mentioned earlier in the program, we're doing so much with these resource hubs, particularly in primary care and mental health. And now we're looking to expand also in specialty care. And we are working a lot with our third-party partners to look at opportunities to provide telehealth to those that don't have that opportunity in their homes. Thank you.
Great, thank you. And you know, in light of everything COVID related in the pandemic, I know we at the foundation have had a great response of caregivers and veterans attending virtual appointments. So that has been a really big positive that's come from all of this. We have time for just about one question here, and I am going to ask, there are just so many. I'm going to ask the last one of Dr. Klobucar. So you mentioned a lot of different telehealth services that are available to veterans on your slides. How do people know if their facility offers those services?
The easiest way is to talk to your primary care provider. I personally use the VA for healthcare, and my primary care provider is my conduit for information. And the patient-aligned care team that you're assigned to, be it the red team, the blue team, or whatever team it is, they'll be able to find out that information for you. So I encourage you, if you want to find out information about what's going on locally, go ahead and contact your VA care provider. They'll be happy to help.
Wonderful, thank you so much. It is 3 o'clock here, and so we are just about out of time. To wrap up, I just want to thank all of our speakers for joining us in today's session. Dr. Lieberman, Dr. Klobucar, Nathan, and Rashi from the Elizabeth Dole Foundation. Thanks to everyone for joining us today. As a reminder, we will be sending today's recording along with all of the presentation materials and links to check out on your own time. In the meantime, stay safe and healthy, and we'll see you again soon. Thanks so much. Bye.